All right, a Botox to pay for government health care. One plan proposing a 10% tax on cosmetic surgeries from Botox to tummy tucks. My next guest says that it would put a real wrinkle in her business. See, we think about this all week and all day when we come up with these leads. Anyway, Dr. Jonathan Walden is a plastic surgeon of some renown, and she's with us.
Thank you for having me.
So obviously you're in the business. You don't like something that's going to put a tax on what you do. You'd be against it, right?
I would be. I mean, anything that increases the cost of discretionary spending is going to have a negative effect on my business. But the real people that are going to lose in this are the patients, because 90% of patients in plastic surgery and cosmetic surgery procedures are women, and they're not elite and they're not rich. They're working class women between ages 20 to 64. So this is going to be discriminatory against women.
Well, what are most of the procedures that you do?
I do breast augmentation, breast reduction, Botox, facelift, nose job, and basically
What's your biggest?
Breast augmentation.
Really?
There's a fine line between...
How much is a breast augmentation?
Breast augmentation, about 85%. And then the rest of it is rhinoplasty surgery, liposuction, tummy tuck.
All right, so, but I'm sorry, the breast augmentation, that's 85% of what you do.
Right.
How much does that cost?
That costs around $10,000 to $12,000 total.
All right, so if it were $12,000, there'd be a $1,200 tax slapped on it.
Right, but I'm taking a smaller percentage of that as the surgeon fee. The other fee goes to the hospital and anesthesiologist.
Gotcha. But that would be the lump sum tax on it.
Right.
And that would be enough, you think, they've done this or explored this in New Jersey. What happened?
Exactly. In New Jersey, the politicians passed this, and it failed miserably. Basically, there's a 72% shortfall in revenue, and that was because of the huge administrative burden and government officials having problems determining, well, what is medically necessary and what is cosmetic. A breast reduction could be medically necessary for a young woman who has shoulder grooving and rashes under her breast. A nose job could be aesthetically pleasing and life-changing to someone, but could also affect the function of their breathing. Or an otoplasty for a small child who gets tortured every day by their peers in school. Those are all examples of cosmetic plastic surgery.
You hear this Botox thing.
Right.
I mean, for Botox and all, that's a relatively simple procedure. How much is a Botox?
Botox injection can range according to the site and the amount of Botox use, but usually around $800 to $1,000 for treatment.
Not excusing any tax. A tax is a tax is a tax, but then you're talking, you know, to $1,000. It's $100 for that. So will that make a difference at the margin for patients who really want that?
It will. It will make a difference. It would affect my practice, many plastic surgeons' practice. But patients that get plastic surgery...
Where do you practice?
In the Upper East Side of Manhattan.
Okay. So you cater to the elite, right?
No. A lot of my patients
are... Upper East Side, Doc.
But a lot of patients come to me from other places in Manhattan, from the other boroughs, and from New Jersey. I have a lot of patients that come to Manhattan because they don't want to pay the cosmetic surgery tax in New Jersey. And they're working...
Well, they also come because you're being modest, but you're well known and well regarded. But my point is that I'm told that, you know, people will give up a lot of things, but not something like that.
Right. Yes, they've been planning for surgery a long time, and actually they've been tucking money under the mattress for a while to do this. And so it's really, it's kind of an unfair tax on someone who's doing something that they want to do. And I mean, if we're doing this, why don't we tax obese people, or why don't we tax McDonald's or Burger King for selling?
Well, doctor, now you're made in my neck of the woods.
Yeah.
All right, very good having you, doctor, but it's just a proposal. We'll see what happens. Nancy Pelosi and many others watching it closely. When we come back, we're from the